Our Hope ICU, which opened up in the beginning of the year, is comprised of 48 total beds, which are medical, surgical, neuro, and cardiovascular. We also have our pre-existing ICU beds, which are another additional 40 beds that we have been using during this pandemic to take care of COVID ICU patients, which allows us to continue to expand on the services that we currently provide here at Baptist Hospital. Ever since we started with the pandemic here at Baptist, the PPEs have always been available to our staff.
I'm very proud to say that no matter what the nurses needed, they had it. So they feel comfortable, they feel protected to be able to give the COVID patients the care that they need. Every nurse that takes care of COVID patients gets their own N95 mask. They also get a pair of goggles or a face shield that they wear every shift. All the precautionary measures are in place.
I've worked in other facilities where the nurse is pretty much everything. They're the respiratory therapist, they're the pharmacist, they're security, they're everything. And here at Baptist, we have pharmacists that are available to us to help us with our medications that are available to come to a code. We have respiratory therapists that are gonna do your ABGs, that are gonna go ahead and suction your patient, help you manage that ventilator. We have intensivists and nurse practitioners that work with these intensivists that are working here around the clock. There's not a time that I walk around the unit that I do not see nurses helping each other out. New patient comes in from surgery or from the ED, and it's not that just one nurse in there. You have multiple nurses in there that are assisting that nurse taking care of her patient. So you're never gonna feel alone, you're always gonna feel supported. And even as a new employee, you're always gonna have that assistance from our educators, the leadership team, and as well as our charge and resource nurses. We have a large team of support staff that is always there to assist the nurse in any moment's notice, as well as leadership that's also available 24/7.
We have multidisciplinary approach, so you can be trained with cardiac patients, you can be trained with neuro patients, and you can also be a medical surgical critical care nurse. The relationship between the bedside nurse and the intensivist and the nurse practitioners is amazing. They work together side by side. We do multidisciplinary rounds every morning and in the evening to make sure the plan of care is updated and they are both on the same page. As a leader, I am there to back them up every single day. The assistant nurse managers get their hands dirty if they need to. They are out there to support the bedside staff.
Even when I'm not here, I always make myself available to the staff during the day, during the night, on the weekend, and I think they really appreciate that.
We have EICU, which is an electronic ICU, that is run by intensivists and critical care nurses that are available 24 hours a day, 7 days a week. They also can educate nurses, newer nurses. If you don't know how to put an NG tube in, they can zoom in and walk you through the process.
Baptist Hospital and Baptist Health strives on excellence, and a lot of times we tell our staff, you know, you are a 5-star nurse. You know, if you were to look at Google Review and Yelp, you know, you want to be that nurse that's pretty much driving those metrics and those quality measures. And if you are that nurse that's working in another state, in another city, in another hospital, and you feel that you are the best of the best, this is where we want you to be.